Hello, my name is Dr. Michael Darson. I'm a urologist at Arizona Urology Specialist in Scottsdale, Arizona. Today, what we're going to cover, we'll do a prostate overview, a BPH overview, and then we'll discuss treatment options. The prostate is a walnut-sized gland at the base of the male bladder. It surrounds the urethra. It produces fluid that transports sperm during ejaculation. The prostate grows to its normal adult size in a man's early 20s. It begins to grow again during the mid-40s in most men. What can happen to the prostate? Each condition affects the prostate differently. Enlarged prostate, or BPH, benign prostatic hyperplasia. Number 2, prostatitis, which is inflammation of the prostate. Or number 3, prostate cancer. Now let's do a BPH overview. What is BPH? Commonly known as enlarged prostate, BPH means the prostate gland has grown larger than normal. The normal adult size is approximately 1.5 inches in diameter. BPH can lead to bladder outlet obstruction that can cause lower urinary tract symptoms. Does BPH mean that I have prostate cancer? The answer to that is no. BPH is not prostate cancer. BPH does not cause prostate cancer. BPH may coexist with prostate cancer. PSA alone does not distinguish BPH from prostate cancer. Both BPH and prostate cancer can have elevated PSA levels. Normal versus enlarged prostates. As the prostate enlarges, pressure can be put on the urethra, causing lower urinary tract symptoms. Prostate size alone does not correlate with the degree of obstructive symptoms or the severity, and it's important to understand that you can have a 30-gram prostate, which is normal size, or a 100-gram prostate, and they be equally symptomatic. What are the symptoms of BPH? Frequent urination, and you may experience that both day and nighttime. You may have the sudden urge to urinate. You may occasionally have burning with urination. You may experience weak flow. You may have the sensation that after you've urinated that your bladder is not empty. You may have trouble starting and stopping your urine flow, and you may ultimately develop the inability to urinate. BPH can affect quality of life. Many men who suffer from BPH may experience a reduction in their quality of life. Up to 95% of men with moderate symptoms are unhappy and don't want to spend the rest of their lives with these symptoms. 51% of men say BPH interferes with an aspect of their normal life. Studies show 49% of men experience sexual problems associated with lower urinary tract symptoms. BPH also can affect a man's partner, their quality of life, their daily routine, and even their relationships. Who can get BPH? BPH is the most common prostate problem for men over the age of 50. BPH affects 50% of men by age 60. BPH affects 90% of men by age 85. In 2010, as many as 14 million men had lower urinary tract symptoms. Obesity, higher body mass index, and lack of exercise may increase the risk of BPH. How is BPH diagnosed? A medical history and physical exam are performed. Prostate exams are done with a digital rectal exam. Urinary output testing helps us figure out peak flow and post-void residuals. Self-evaluation of symptoms is also performed. There are validated questionnaires such as the American Urologic Association Symptom Index, the International Prostate Symptom Score, Quality of Life questions, and Bladder Impact Index. Let's discuss treatment options. It's always best to start with the least invasive. Let's start with behavioral modification. That consists of fluid and diet changes, watchful waiting, and Kegel and bladder retraining. Let's move on to first-line therapies. First, there are BPH medicines. There are alpha blockers and 5-alpha reductase inhibitors. Then there are first-line in-office therapies, resume water vapor therapy, and prostate urethral lift, which are permanent implants in the prostate. And moving from least invasive to most invasive are the surgical procedures. These are hospital-based procedures that require general anesthesia. There's the green light laser, there's the traditional TURP, and there's the laparoscopic prostatectomy. No dietary supplement, combination agent, or other non-conventional therapy is recommended for the management of LUTS secondary to BPH. This includes saw palmetto. What is watchful waiting? Watchful waiting involves lifestyle modifications such as adjusting diet, evening fluid intake, medication use, and exercise patterns. Medications. First, alpha blockers. What are alpha blockers? They help relax the muscles of the bladder and prostate, allowing urine to flow more freely. 5-alpha reductase inhibitors. What are they? They're designed to stop the growth or shrink the prostate by lowering production of the hormone DHT, a male sex hormone. Studies show up to 70% of men stop taking their BPH medicines within a year. Resume water vapor therapy. What is it? It's an outpatient therapy that uses the natural energy stored in water vapor to shrink excess prostate tissue. There's no general anesthesia, there's no permanent implant, and there's only a 4.4 surgical retreatment rate at 5 years. And now we will show an animation of how Resume water vapor therapy works.
This short in-office therapy shrinks your prostate, relieving your BPH symptoms and preserving sexual function.
And now you'll hear from Joe, a Resume patient, and his spouse, Terry.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. And went to my doctor, and he put me on some medication, told me I should see a urologist, which I did, and it was confirmed that I had a enlarged prostate. It got to a point where the pills really weren't working, and then one night I got up in the middle of the night to relieve myself and wasn't able to. I ended up going to the emergency room, and they catheterized me to relieve it. That happened 3 times. And after the 3rd time, we've decided to take some decisive action about it. Taking my medication wasn't a long-term solution for me, and I was looking for something to replace it and solve the problem, so to speak. And that's why I looked for new technology in Resume.
It was somewhat like going out with a toddler. You have to scout out every washroom. We would go out to dinner, and as soon as we would get to the restaurant, he would excuse himself to go to the restroom, and there I would be standing with the hostess. Then usually midway through our meal, he would have to go to the restroom again, and that happened for a few years. When we would travel on the road, he'd have to be stopping constantly, and I was getting annoyed because it would make our trip quite a bit longer. And then him getting up 3 and 4 times during the night, I knew he wasn't getting proper restful sleep, so that caused some concern on my part for him.
I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good.
When I first heard about Resume, I looked it up on the internet, and I thought, what? I had never known there was another avenue to go down that didn't involve cutting and much more invasive treatment.
My experience with the Resume procedure was very good. Didn't take a lot of time. It was not a lot of pain. I thought the technology was great. They showed me everything as far as the equipment that they were using and how they were going to use it. The technician from Resume was there to assist the doctor. I was very satisfied. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Resume procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Resume treatment has made a very big difference in our life.
Oh, it's been absolutely great. I find myself not going to the bathroom as frequently. I'm able to sleep through the night, get a good night's rest. I'm thoroughly pleased. The Resume treatment has helped me resume my life.
Prostate urethral lift. What is it? It's an outpatient procedure that utilizes permanent implants to lift and hold enlarged prostate tissue out of the way so it no longer blocks the urethra. There's no general anesthesia, there are permanent implants, and the surgical retreatment rate is 13.6% at 5 years. Green light laser therapy is an outpatient procedure that uses a laser to vaporize away the prostate tissue. There is general anesthesia, there are no permanent implants, and the surgical retreatment rate is 4.8% at 5 years. Now we'd like to show you an animation of how the green light laser works. Transurethral resection of the prostate, commonly known as TURP. A TURP is an outpatient procedure that uses a heated wire to cut through prostate tissue. There is general anesthesia, there are no permanent implants, and the surgical retreatment rate at 5 years is 5.8%. Prostatectomy. A prostatectomy is an outpatient procedure that involves surgical removal of the inner portion of the prostate via an incision in the lower abdomen. And the surgical retreatment rate at 5 years is 2.7%. Insurance coverage. It is the responsibility of the patient to contact their insurance provider for specific coverage information. In summary, we've talked about the prostate gland and what it does, we've done a BPH overview, and we've discussed treatment options, starting with watchful waiting, then first-line therapies, medical therapy, resumed water vapor therapy, and permanent implants, and we've talked about surgical procedures such as the green light laser therapy, a traditional TURP, and a laparoscopic prostatectomy. Next step, consult with your urologist to determine which treatment option is best for you.